Hello, and thank you for those that have joined our Navigating eBenefits to Make Your OE Elections webinar. We're still a couple of minutes before the start of this training today, so I'm going to mute and give other attendees a couple more minutes to join. Thank you. Good afternoon, and thank you very much for joining the San Francisco Health Service Systems webinar on Navigating eBenefits. My name is Rin Coleridge, and I'll be taking you through the training materials today, and I'm joined by my colleagues Holly and Jessica, who will be helping as we facilitate your questions. So let's take a quick look at how our goals are and how we will proceed with this training. By the end of this training, you should be able to make your open enrollment elections online. And what you learned today is also applicable for making changes during the year if you have a qualifying life event. You'll also see how you're able to review your current benefit elections. So how this training works is that we are using a Microsoft Teams live event. You are on mute for the entire presentation. However, if you in the top of the screen there, click on the little Q&A box, so it's a little call out with a question button, it'll open up a little dialog window where you can ask a question, and we will respond to you, and also we'll share your questions out for others to also learn the answers. And Holly and Jessica are helping facilitate that piece of our training. We do ask that you don't share any personal information in terms of personally identifying information, your DSW number. If you have a question that's more complex, you can call into our member services and they can assist you with that question, or you can also set an appointment for a consultation. And the Q&A session will follow at the end of our training, but by all means, throughout the training, go ahead and ask your questions so we can get your responses to you. Some system prep for you. eBenefits is a web-based system, and so if you do enter with any difficulties, we suggest clearing your cache. You do need pop-ups enabled and cross-site tracking, and we do have instructions and troubleshooting tips all online as part of this training. We'll show you where you can go find that information. I'm going to skip ahead on a bunch of these slides here somewhere because for attending this webinar today, let's go find it. There is a raffle prize drawing. Our communications team has gathered some really lovely prizes, and you have multiple ways to win. We have a better URL than that. You don't have to put all that in there. This is an older slide, sorry about that. But We will be posting into that chat window various links for you throughout the training to make it easy for you to link where we need to go, where you find materials, and also a link to this form where we will take your contact information so that if your name is drawn, we know how to reach you for doing a couple of things. One, attending the webinar and submitting your elections through eBenefits. You're going to get entered to win some really fabulous prizes. All right, so moving right into it, I'm going to flip over. I would like to let you know that I am in a test environment. So things might look very slightly different, but I'll take you through there. The first difference is the address that I go to. We'll put in the chat for you, but the URL to go to for eBenefits is myapps.sfgov.org. This training assumes that you have already registered your account. If you work for the City and County of San Francisco or the Superior Court, you don't have to do any account registration. You already have an account. If, however, you're a retiree or you work for the Community College District or the San Francisco Unified School District, and you've never registered your account before, there is a one-time account registration that you do need to perform. That is outside of the scope for today's training. However, there's information on our website about how to register your account, and there's another webinar taking you through how to register your account, and that's coming up this coming Monday at, I believe, noon, and you can find that information on our website. So when you go to myapps.sfgov.org, you'll enter your DSW, and then you will enter your password. Well, ideally, you will put in the correct password. And we do have multi-factor authentication. I had already authorized myself into the system earlier this morning, which is why I wasn't prompted this time, but you might find you're prompted for however you set that up, which is either to answer a secret question or put in the code that you perhaps have routing to your authentication app or to your phone. Again, that's all part of training covered in registering for eBenefits. And as I said, I'm in a test environment, so I have this thing that says test in here. Yours will just say SF Employee Portal. You may have more or less icons on your My Apps dashboard. That just depends what role you have in terms of if you're actively employed with the city and other things your job does for you. But you definitely should have an SF Employee Portal tile, and you want to click on that one, and it gets you into the Employee Portal page. Even if you are retired or you're not working for the City and County of San Francisco, but one of the other employer groups, it still counts as the employee portal. I have my browser really zoomed in. All right, so here we are on the employee portal page. I think my signal's a little slow. Usually there's some video links here, so missing that. I am in test environment. First of all, let's talk about where you can see your current benefits. On the top half of this page, and your screen may look different than my screen. Again, I do work for the City and County of San Francisco, so I report my time through here, and my payroll also comes through here. So I may have some links that you do not see. You also may or may not see the My Information slide out. But you will see something called My Benefits. And this, if you click on it, we say it's a slide out, because when you click on that tab, information slides out of the slide. And if you click on it again, it slides back in. In that slide out, and again here, this may look different for you as well, because it depends what benefits we administer for you. And so you may only see medical or dental. You may only see medical, or you may have a whole host of other benefits that show up here. And this always shows you your current coverage. And so this is coverage as of today, October 22nd. Now, what we're doing here during the month of October is making our enrollment elections that begin January 1st, 2022. And so if you click on My Benefits, you won't see the changes that are upcoming in 2.5 months. But come January 1st, 2022, if you were to click on My Benefits, you would then see what you have elected for the 2022 plan year. So again, My Benefits is always, what are my benefits as of right now, today? On the bottom half of this screen, and again, we may see some very different things. I may have some other tabs than what you have, but you will have an alerts tab, and we have a Open Enrollment alert right there. And this is one way that you can get into your eBenefits. I'm going to show you the other way, which is if you were to click on My Links, and you notice the tab that's active ends up being the lighter colored tab. There's also an Employee Links tab underneath it. Again, you may only have Employee Links, or you may have some of these other tabs. On the Employee Links tab, you may have a lot of things like me, or you may have barely anything on here, but what you will have is a section for eBenefits. Let me see, I'll make that a little bigger for you, so that hopefully that's a little bit more visible. But under eBenefits, there's Open Enrollment, so that's another way to navigate to the same thing that we have the alert. And then,
Rin,
please.
hi, Rin. This is Holly. You were just speaking to, being able to see exactly what's current on eBenefits. But there is someone who's attending, and they've actually made a change. It's Christina, and she said that Christina sent the change of enrollment benefits specifically for their basic VSP. But how would Christina know if the form was received on time before that October 29th date? And will the change be made?
Thanks. There's a couple ways we can do that, and I'll give some hints as we go through. So Christina,
sorry.
Christina, thank you. If you had faxed or mailed in an application, that's going to need to wait for our data entry to happen. And the way you definitely know what we have is we send out confirmation letters to everybody, and we will have those out the door around just after Thanksgiving. And so you'll get that letter within that first week of December. And as you go through eBenefits, if you did it that way, at the very end of the process, which we'll look at today, you can print out a confirmation statement. That confirmation statement is really, hey, this is what I entered, but we still have to review items before they become official, because let's say you added a dependent, but we didn't get all your supporting documentation. We may not process your dependent being added. So it's definitely either way, always very important to make sure that you get you get that confirmation letter and you look and see what it says. And then there's a short window of time where you can get us any corrections. If you did submit it through eBenefits, hopefully you printed out your statement, and at least that's your copy of what you have done. And so when you get your confirmation letter, if anything there looks different than what you submitted to us, you'll have that as your proof of what you had submitted to us. So those are essentially the options available to you. If you mailed or faxed, ideally you have a copy of, you kept either a copy of the form or what you sent to us as your idea. But it's really that confirmation statement that comes in December that'll tell you for sure. But I will show you a little tips and tricks that we can do with online eBenefits, which is why we encourage people to go to eBenefits, because you get a little bit more flexibility to do some things there.
Thanks, Rin.
So we were talking about open enrollment right there. So that's only open during the month of October. You have until 5 p.m. October 29th this year to submit your elections for 2022. But at other times during the year, if you have a qualifying life event, such as you were married or divorced, or let's say your spouse lost coverage, new child, those are what we call qualifying events, where you have 30 days from the event date to be able to come in and make those changes. And so this is how you would do that. And what we're going to show you today about how you navigate through eBenefits is the exact same thing as to if you were navigating for open enrollment. So that's why we like to show you how to come from there. So
and
Rin, click on that. Yeah, please.
Christina is live with us, and she's actually asking a follow-up question, which is, can you do both? Can you do the mail and the online eBenefits?
Well, you could, but we encourage you not to, because now we're getting into some timing windows of what you're intending. And so let's say you submit something. If you did an application and you mailed it in, let's say yesterday, and then today you thought to yourself, oh man, what I put on paper was wrong. What I really meant to do was this other thing. So you go online today and you did that other thing. But we won't get your application until probably sometime next week. And we're always going to do the most recent thing we get from you, right? And so even though to you, you're thinking on 10/22, I submitted what I really wanted because my 10/21 application I put in the mail actually wasn't quite right. But we may not get that 10/21 mailed application till next week, 10/26, let's say. And so from an HSS perspective, we're going to be like, oh, what's on this paper application now supersedes what's online because it's more recent to what we received. So it starts creating some confusion. I mean, if you're doing the exact same thing in both, it's okay, but then somebody's going to go in and have to type what you sent in an application. The good thing is with eBenefits, it's right up to the minute, and so you can come back in multiple times during the month. What'll happen is when you submit your enrollment online, at some point, we're going to start processing it. We have over 70,000 subscribers. So if everybody's sending in something, that's a lot of review we have to do to make sure we've got it all finalized, to get your letters to you when we need to get them to you, and submit to our health carriers who's covered with them. But if you get to, we're already getting late in the month, but if you log in, let's say this week, and you get an error message that says no open event, that might be because we already processed your event, but that's okay. You still have till October 29th at 5 p.m. So if you call into our member services at 628-652-4700, you can just ask them to reopen the event, and then you can go back in there and do it. So just some thoughts about it. There's nothing that says you couldn't do both, but it does create some confusion.
Thanks, Rin.
All right, so I logged in here a little bit earlier, so that's why my screen is a little bit different, but let's get you navigated to eBenefits. So after you had clicked on that open enrollment alert, it brings you right into eBenefits. What we have at the top here are what we call breadcrumbs, and they let you know where you are in the process. And actually, when you first come in, this is not in a solid green, and neither is this, but I was already in here doing something. They would look more like this: red meaning you haven't done it yet, green meaning you have done it. The very first screen that you get to is who your dependents are. So these are currently people that I have enrolled as my dependents. If I have a new dependent that I'd like to add, I'll click on the Add a New Dependent, and it'll pop open into a screen where it's going to request name such as, first, last name, date of birth, gender. The items that have an asterisk by them, let's see if I can make that, ooh, I made that bigger, boy, such as that, are required fields. For the most part, Social Security number is required. I know we don't have an asterisk, but that assumes, if you're a newborn, 30 days, a couple months old, I think we give you 6 months on a newborn, then of course you may not have a social. But if you're adding a dependent that's anybody other than a newborn, and we get this from you without a social, we're not going to be able to process your dependents. So just keep that in mind. But you go through and you fill out the information, and then you make sure you click save, and then close this out. And once you do that, you would see your new dependents listed. If there are other dependents you don't see listed, it could be that they are no longer eligible. For example, if you have divorced, an ex-spouse would not show up in this list. Or if your spouse or partner was deceased, they may not be there. Actually, I'm going to go back to adding a new dependent because there is something important I would like to call out. You have to provide us the relationship to the employee. And if you click this field and you get a whole pick list of items, but even though you can choose things like ex-spouse or grandparent or grandchild, Just because you can add a dependent that's in one of those benefit categories doesn't mean they're benefit eligible. The reason you're seeing that is because you could also add people who for beneficiaries of life insurance. And so that's more flexible. I mean, even if you want to make your neighbor your beneficiary for your life insurance, you could do that. But if you add a dependent and then you go into trying to add them to your health benefits and you don't see them showing up, it could be you selected a relationship type that is not eligible for HSS benefits. What I'm showing here on the screen are the relationship types that are benefit eligible, and that would be a child, a domestic partner adult, a domestic partner child, an other child hyphen legal. These are dependents that are court ordered coverage. Other IRS, and you'll see a non-dependent adult and non-dependent child. These are same thing as domestic partners, but these are people that do qualify for tax favored status. So keep that in mind if you're adding your dependents about the implication of that. It's very important as you go through eBenefits that on each screen you click save and continue, and that's sending information back to our servers and registering any changes that you have made. The next item that you'll be requested to do is to confirm your contact information. And if any of this is wrong, you can just click the pencil icon and you can go in and you can make the necessary changes. I will say that, and so here you see me doing that, and I see actually my home address has an error. If you work for the San Francisco Unified School District or the Community College District, you cannot come in here and make changes. That is at the request of your employer. They are the system of record for your address, and so so I'm trying to get over here to my save button. I've got different resolution happening. And so you have to change your address with your employer, and then they transmit that information over to us. So keep that in mind. You may, if you're not able to edit it, there's a reason for that. Make sure you click save and continue, and then you'll continue through to the next screen. So now you've done the required responses. Let's talk about where we're getting here next as this page loads. So then you'll get into a section about your current elections. And so this shows you, and again, your screen may vary based on what benefits we administer for you, but it'll show you what you currently are enrolled in for 2021. And then it defaults more or less to assuming that you're going to keep the same thing. So that's why for me, everything is in green and says the same. And then it tells me what I would pay for these benefits next year if I kept the same thing. Again, I'm in a test environment with some dummy data, so don't pay strict attention to the dollar amounts you're seeing. But as you go through eBenefits, you will see your correct dollar amounts. If any of you are currently in the UHC PPO, also known as City Plan, we are changing the administrator of that plan in 2022 over to Blue Shield. So you'll already see that your new election is different. It'll have a red in there that calls out it being different because we've got a different administrator. At the bottom of this page, you get a question about, do you agree with the new elections shown above? So if you don't want to make any changes, other than FSA enrollment, if applicable to you, then you just click yes, and it'll just fast forward you to the end of the whole eBenefits section. But if there are changes you want to make to your medical, dental, or vision, if we do administer all of those for you, just click no, and it'll go through each screen at a time. And just a note, FSAs are not available to retirees because that's pre-tax contributions, so you have to be getting a paycheck. And for the Unified School District and Community College San Francisco, your FSA is not administered by the health service system, so you won't see that as an option here in eBenefits. So I'm going to say I don't agree with the new elections because I actually want to go through and make changes to some of my medical and dental, so I'm going to say no. I'm going to click save and continue. And as I do that, our screens have changed, so let me show you a few things about this. First of all, you can navigate around if I decide, oh, I want to go back and look at my dependents again. I can click on these breadcrumbs up here to jump around. Same thing within here. This is now showing me that I'm now on health. And for me, in the health section, I'm going to make elections around medical, dental, and vision premier. And as we navigate through, we'll have visual cues that we have finished these items. And then I've also got the flexible spending accounts we can do. There are links to your benefit guide. So you can click here and your appropriate guide will show up, whether you're a retiree, whether you're MEA, whether you're city and county, or whichever employer. In the top up here, there's a shopping cart, and you can always click the down arrow to expand that, and it's showing you where you are with your costs. Some of these are, you cannot select their employer provided benefits, such as life insurance and disability insurance. And you'll see these numbers potentially change as you make elections in each of the screens. To enroll dependents, so if you added a dependent in that previous screen, you would see that person's name appearing here as well. But to add people, you would just put a check by their name, and you'll notice I just changed from member-only coverage to member+1 coverage. If you had a dependent enrolled and this year you want to disenroll them, you just have to deselect the checkbox by your name. Now, I'm the HSS member, so I cannot deselect me or select me. Essentially, if I don't want myself or any family covered in medical, I would have to click, words are hard, on the waive this coverage checkbox. I actually don't want to waive this coverage, and I would like to enroll my dependent, so I'm going to click on enroll my dependent. And I'd like to show you a couple things there as well. First off, I want to show you that as member only, as we come down here, and I'll show you this navigation in a moment. These dollar amounts are completely wrong because I'm in a test environment, but hopefully this will update in a moment. It may not. But if this dollar amount here is dynamic and it's showing a negative 37304, if I select my dependent, you'll see this dollar amount changed. And so these do update based on if you're what coverage tier you're enrolling, E only, E+1, or a family tier. The other thing that happens in this section is the plan that you're currently enrolled in has a green bar that shows currently elected. And we have, for active employees, there's actually 5 different medical plans available for 2022. So they don't all display on the screen at one time. So you do need to scroll right to view them all. And then you can scroll back left. If you decide there's a different plan you want to enroll in, then you're able to do that by clicking on the blue button that says elect this plan. And now it shows that this is my currently elected plan. In addition, with all the medical plans and all of our plans, these blue buttons at the bottom are also links. And so one of these will go out to the microsite of the provider. So here we see being taken to the Canopy Health provider. And I'm going to click on that tab that says Decision Engine to get back. And the other tab gets me into plan documents where I can view all the specific evidence of coverage, summary of benefits, the SBCs for a plan. So as you're researching and deciding which plan is right for you, those are links that you can click on. So I've made my election. I've chosen HealthNet Canopy Care. And again, up top here, I had selected to enroll my dependent. So there's my member+1. And I'm going to make sure I click Save and Continue. So as soon as we click the Save and Continue, then our shopping cart updates and that change is registered.
And Bryn?
Please.
We have someone who's been listening in on all those options, and they're asking that they used to be able to talk to the representatives in the during the open enrollment date period, and they're wondering how do we get that information for those consultations?
Thanks for that question. If you go onto our website, sfhss.org, let me see if I can get a tab in here and get over there. Sure. And, ooh, got my screen kind of big because I was trying to zoom in to help us be able to see what I was doing in eBenefits. But I believe it's on the Contact Us. And if I scroll down there, am I right? Did I get it right? Oop, I might not have gotten it right. I know my other colleagues are on this call and probably could tell me where I need to navigate to.
Hi, Rin, this is Holly. So I believe it's under enrolling and making changes,
Okay.
and then open enrollment.
Oh, thank you.
Yeah, and then within this page, there's office hours with health plans.
Make an appointment to talk with medical plan reps and get your questions answered. Thank you very much for helping me navigate there. And you can also call and talk to our own benefit analysts by calling our member services department.
And I know
And-
Jessica, she is on the line. She may be able to help even further.
Yeah, Rin, correct me if I'm wrong. When you're in eBenefits and you're selecting the health plans, there are links when you look at each of the individual health plans where you can go, and I believe even the provider search link may be available.
Yeah, sure are. And we did that a moment ago, and I've got things on my screen I can't get out of my way. Dang it. Here, let me do this. Let me minimize that a little bit, then I can get to the right. So when I had clicked on that screen, do that. Thank you. It brought me, I happened to click on the provider link for Canopy Care because I was most interested in that one. And it got me into their microsite where I could get all sorts of information about what do I see for doctors and services in my area or where I'm at. So there are ways to do that. And I thought, and Jessica, maybe you can assist me. So we've got on the OE pages how we can make appointments with members from the health plan, or also your voluntary benefits if you're with City and County of San Francisco or with Superior Court. But also you can make an appointment to talk to a benefit analyst, and that's that's where I was looking for the link that I thought was on the Contact Us page, but I clearly got that wrong.
Oh, I think that's topic dependent. So if you're, let's say, about to retire, you can schedule a retiree consultation. And when you go to enrolling and making changes and you find the one that's about retiring, getting ready to retire, there should be a link there. Perfect. New retiree, I saw it just a second ago.
Yep, I've got it up on the screen. Yep. Okay, perfect. Thank you very much, Jessica, for clarifying for our members how you're able to make appointments to get some assistance. That's great. So back here to eBenefits, I had just finished electing my medical for the 2022 plan year. And so you'll notice now this has a check because it's telling me, yep, I've got this one done. And it's also, there's a little gray in for health because I've started doing the health part. And even my breadcrumbs up here, I'm in yellow, I'm in here now, and I've got a little partially colored in circle because we're moving along. And there's an orange underline in dental. So I'm like, oh yeah, I'm on dental now. This navigates the exact same way as what we just did with medical. You've got your links to your benefit guide. You click the checkbox to enroll dependents or uncheck the box if you want to disenroll your dependents. Check to waive if you'd like to waive. And then you've got the dental plans to choose from. You may not see the dental section if you're with community college or unified school district. You will only see screens for the benefits that are applicable to you. But again, I'm currently enrolled in Delta Dental and it shows me my cost. And you can read about the plans. And again, here's these links Jessica was talking about where you can go and search for providers. So it takes you to the microsites for our health carriers where you can learn more information, or these top links take you to the plan documents. I actually don't have any changes I'd like to make on my dental this year, so I'm just going to click Save and Continue.
And Rin, we have an anonymous attendee who's noticing that the section where it says my cost. And the question is the total amount in the shopping cart, the total amount for the benefits, a biweekly or monthly payment?
Oh, that is a super question. That one gets like extra points. Can you give them extra raffle options there for us? Because our system knows if you are on a biweekly or a monthly deduction schedule. So of course, retirees, you're all on monthly schedules, but for some employees of the community college or the unified school district, some of you are monthly. Our system knows how we have you set up. And so what you're seeing here in cost will reflect how you get paid. So if you get paid by your employer on a monthly basis and we're done doing those deductions on a monthly basis, these values are month. Everybody who works for the city and county of San Francisco, the Superior Court, and really most unified school district and community college employees, we are biweekly, and so these are biweekly. Great question. Thank you.
Thank you, Rin.
And so I get a check mark by dental. I've gotten that one done now. My orange line's under Vision Premier. And I've got this little message up here. What's this all about? The Vision Premier coverage has been modified to match my medical coverage. Well, that's because I added my dependent child onto my medical. And that Vision Premier coverage, it is what we call a buy-up plan. So when you get medical coverage through the health service system, it includes basic vision. You don't have to select or enroll in it. It comes with your medical enrollment. And we're offering Vision Premier, but Vision Premier is an add-on to the basic. So you have to at least have basic to go to Premier. And because it's all packaged as part of that medical enrollment, it has to match. So if you have all of yourself and your dependents that are in medical, all have to be in Vision Premier. You can't just decide, oh, I'll just do it for me, but not for my child. So it comes as a package deal. And that's why, because I made the change there, it updated it for me here. And the other thing about the Vision Premier plan is, let's say I was previously waived. So I'm just going to waive myself. And let's say I just came into this screen and I'm like, oh no, this year I actually want that Vision Premier benefit. I'd actually have to go down here and click to elect this plan, and that might not be as intuitive as on the screens with medical or dental where you have multiple choices and you're like, of course I'm going to click on which one I want, so the health service system knows which one. But when you get to the Vision Premier, you might skip like actually clicking on elect because there's only one plan, but we still have to have this is you actually saying, yes, I want it. So we still have to have you actually click on that so it says currently elected and it's in green. So I know that sometimes trips some people up. Same thing, we've got your links there to the microsites or to the plan documents. And I'm going to save and continue. And so I've gotten through, for me, all the elections that I can do around my health portions. And so you see I've got the checkbox on health, and now it's putting me into the flexible spending account section. Again, this is for City College and Superior Court. For community college and unified school district employees, your FSA is administered separately, and you'll contact your employer or your benefits office to ask your questions about enrolling in your flexible spending accounts. These are IRS approved pre-tax dollars that you can use for qualifying healthcare expenses, such as copay deductibles. Here on the right or the left, wow, I don't know my left from my right, but anyway, on my left, it's showing me what I pledged in the 2021 plan year. So that helps put it in context if I didn't remember. And you are required to re-enroll in an FSA every year. That's why for city and county and court, we don't let you skip this screen. And you'll always come to this screen whether you said you wanted to make changes with all of your other enrollments or not. I'm going to click on the checkbox to enroll. For the 2022 plan year, you have to enroll a minimum of $250, max of $2,750. So if I try to enroll $3,000, I'm going to get a little error message. It says that is outside the min or max, and yes, it is. So I'm going to change that. I think I'll go $500 for next year. And now it likes me, okay. You still have a link to the benefit guide. It's a little different on this page. We don't have those blue buttons to get to your plan documents, but we do have the links embedded in the text here to get to our FSA vendor, which is P&A admin. So that's padmin.com. And we also have a link to our website where we tell you about what are FSAs and what are your qualifying expenses. So I'm going to save and continue. And now it'll load to the dependent care flexible spending account screen. And so you see I've got my checkbox here by my healthcare. I'm part of the way through taking care of the FSA portion of my enrollments. And I am not going to enroll in a dependent care flexible spending account. I was waived this year and I'm going to waive next year. Although if you decide you want to enroll, just click the box and put in your dollar amount. And that is your annual contribution that you're putting in there. So I'm going to save and continue. And look, my elect benefits has now gone fully green because I've now gone through all the steps of having to elect my benefits. I get into a little review section and I want to call out some important things here. So let me zoom in a little bit. Ooh, it's kind of big for me, but hey, we can make it happen, I think. Ooh, that might have been too big. All right. First of all, take a look at and read everything. Medical, yes, I took Health Net Canopy Care. It's telling me my cost here. It's showing me my dependent and that they're covered. If you have more than one dependent, all of your dependents will be listed here and just check if they're covered or not. For example, I did not elect to enroll my dependent in dental. And so even though their name is listed here, you see the N by their name. So that's the important piece of information. It's not just does their name appear, but are they covered? Yes or no. If that's wrong and you meant to enroll somebody, just click the pencil and it'll take you back to the screen we were before. So for example, I click on that. I'm going to end up back on that dental enrollment screen and I can be like, oh yeah, totally wanted to enroll that dependent. And make sure you click on that save and continue so that your election registers into the system and it's getting saved in there. And then I could step back through each screen again, or I could just go back to my review and submit. So you do have options for navigating as you get more comfortable. And again, we have a host of materials on our website that show you how to navigate through eBenefits. So other than this webinar, which you can rewatch, you also can just pull down a PDF that has a step-by-step of each of these steps so that you can go at your own pace when it's a good time for you. So I've looked at the rest of this now and I'm like, yep, that all looks right at me. So I'm going to continue. Now, not only is it very important that you click save and continue through each screen, but you have to submit your elections. So if you've done everything else but this page of submitting your elections, then we do not have your elections for 2022. Now, there is a lot of text on this page. So let me just give you the cliff notes on what's here. Primarily, it's telling you that you're authorizing deductions, either you're out of your pension or your paycheck. So for your share of your premium contribution, and that we're sending your information to those selected insurance carriers. Then we've got required arbitration language. These are things that used to be on the back of the paper enrollment form. And so if you're enrolling in Health Net Canopy Care, there's their arbitration language. And if you're rolling with Kaiser, there's their arbitration language. And basically, we're saying that if you click submit, you are agreeing to these terms and conditions. So you're agreeing to the deductions, you're agreeing to the arbitration language if you're enrolling in one of those two health insurance programs. If you are not okay with that, you need to go back and elect something else. So if you do not want to agree to these arbitration terms, then there's the other plan choices that are available for you. I'm okay with this. I'm going to click submit, and that's the real important button. Because now you're getting to the part where you can get that confirmation statement, which I think is maybe part of Christina's question from earlier. And so we'll see that come up here. So now I've got greens all along the way. And now I've gotten to enrollment completion. So we'll look at a few things on this page. First of all, if I get to here and I'm like, oh, that's wrong, I can still go back to modify elections, even though you click submit. And so now that's now being sent to HSS. If we have not yet processed it, you can come back in all the way through 5 p.m. October 29 and say, oh, no, I'm going to modify again. I wanted to do something different with that FSA amount. If you come back and you get a no open event error, it means we've already processed it. But if you're before October 29th, 5 p.m., give us a call and we'll just reopen your event and you can come in and make your changes. So your enrollment completion, this is the only time you can come here and do that. for this session of what I had elected today. So make sure you click on print confirmation statement. Now, if you don't have a printer, that's okay, because you don't have to actually print it out to a printer. You could just save this as a PDF, and you could save it to your computer or your phone or your tablet, whatever device you are using to enroll in eBenefits. We are mobile responsive, and you can do your enrollment from multiple items. So I'm just gonna save my PDF. I'm gonna call that, my elections 2022. Get the feeling I've done this before. And then I can just click close out of this statement. And so when you get your confirmation letter from us in December, if anything looks wrong, then you've got a copy of this statement for your use. And again, these elections, this is what we say at the bottom here, have been submitted, and they are subject to review. They're not yet finalized. We have to do a review to make sure they adhere with SFHSS member rules. If you've added new dependents, we have to get that supporting documentation first. So how do you do that? Well, that's also on this very same page. So if you scroll down, there's a section here about uploading documents, and we're like, if it's a spouse that you added, we need a certified marriage certificate. If you added a domestic partner, we need that domestic partner certification. And if it's a child, we need either the birth certificate or the adoption certificate. And again, we do have step-by-steps that show you all the details, but I'm going to click on upload documents, and this window will open. So first of all, I'm going to say,
Rin?
Yes, please.
Oh, this is Jessica. I did see in the confirmation and benefits confirmation, could you clarify for members, because I know this came up at an earlier meeting, we had members bring this issue up. During open enrollment, let's say you're a little unsure about the cost of the plans for you, for yourself or your family. You don't need to worry about hitting that submit button, because let's say you get to the end and you see your confirmation, you're like, oh no, I want to select a different price plan. This is more than I wanted. That submit doesn't mean it's final. You have all of October and you can go back in and change your elections. Is that correct?
That is absolutely correct. And yeah, that's what I was talking about. If you log back in, if I come back in another session, I'll end up on this page and I'll just click modify elections. We will take the final thing that you submitted before we hit that deadline. And if you do come back and it says no open event, just means we processed it, but you still have a right to keep changing it all the way up to October 29th. So just give us a call and we can reopen the event for you. Yeah.
Go ahead, Jessica.
Please.
Oh, there were a few other questions that came in. Some of them was about FSAs. One was, does the dependent FSA, is it able to roll over as well? And I did respond, it really depends on what you mean by rollover. So if you're just looking, if you're asking if you elected FSA last year, as if you'll also have the same amount FSA this year, the answer is no. You have to annually re-enroll in FSAs if you want to continue that program. However, if you're talking about whether or not you have leftover funds, any leftover funds in the amount of a minimum of up to $10, or sorry, minimum of $10 and a maximum of up to $550 can roll over into the next plan year for you to use. Otherwise, you will forfeit those funds. So we recommend you use up all of your FSA funds. That is the amount that can roll over into next plan year. And child care dependent care FSAs do not have any rollover. So anything that's unused from child care dependent care FSAs will be forfeited.
Perfect. Thank you, Jessica, for explaining that to us. And yeah, your qualifying expenses for that FSA have to be incurred by December 31st, and then you have till the end of March to submit those claims. I feel like we're probably all in that hurry up and use our FSA since we haven't been necessarily doing all of our appointments. So a little hot tip for you, for your spouse, that is, you can use your FSA for your spouse's expenses. So I know lately, as my spouse has had her doctor's appointments, I'm like, here, let me pay your copay, because I got to get my FSA down, or I'm going to end up in that situation where I'm going to forfeit. Let me take you through the document upload, and we'll definitely have time for questions because we're almost done here. I'm going to click Add Attachment. If I then click Add Attachment, I'm going to get an error, and that's because if this is a highlighted field, it wants a subject. It doesn't matter what you call it. I could call it, birth certificate, or I could call it, supporting documentation. It's just a text field. So whatever makes sense to you is fine. I'm going to say Add Attachment. I'm going to choose File, and I'm going to look for the file I want to upload. Well, let's see. And so maybe I have that in my documents. Sure, I'll upload that. So if if you had a picture you had taken of your document, or if it's an actual file on either your computer or your phone or whatever, navigate to where that document is. Then you click Upload, and when you see it show here, then you know the file name that it's being uploaded. Make sure you click Save, and it'll show it's saving the page. Now that saving message went away, and actually if I scroll down now, sorry, I have a lot of documents that I've uploaded this OE because I've been doing a lot of training, but here's my October 22nd at 12:46 p.m. There it is. I called it supporting documentation. I see it in the list, so I know HSS has it. I click the X box to get out of there. I'm going to click Save and Continue. And if you are Superior Court or City and County, we have a page that tells you about your voluntary benefits. USD, CCD, there's some guidance there for you on where you need to go to be able to do some of your other enrollments for your other benefits. I'm also going to go to sfhss.org, and I know my colleagues are putting these links in the chat. eBenefits, and that's the shortcut there because I know the website URL is eBenefits, but here's where you can find help on if you haven't registered your account yet. Again, we have that webinar coming up this Monday at noon, but here's the step-by-step instructions. But if you have already done that, here's just the basic steps. But if you continue to scroll down, we have information on step-by-step instructions, how to do what we've done today. There's video on everything we've done. If you don't want to sit and watch the whole video, you don't have to. We have links that get you right to the part you might want to know more about. So if you're like, well, how do I do this dependent care FSA part? Just click the link that says that, and it'll take you right just to the portion of the video that covers the information you're interested in. And there's some additional resources here about how to print your statement or some troubleshooting. And so you'll find all that information, as well as where to get additional help. So depending on what your situation is, if you forgot your password, here's what you can do, or who you need to contact if you're not able to get past a certain point. And I want to make sure we leave enough time for questions. Don't forget, there's a raffle for attending today, so make sure you complete the link that was put into our chat for you to get your name in the hat, as it were, for some of those great prizes. And I will pause and take questions.
Hi, Rin. We do have a question from an anonymous attendee who's saying, I didn't get my printout or save to my computer. And is there a way to obtain it for my records, even if the event is already closed?
What you can try to do is this. You can sort of, if we haven't processed your event so that you can still get back in, let's say I've signed out. I'll sign out. And I'm logged off. So here we are another day. I'm going to come back in. So here's what it looks like, whether you came in 5 minutes later or 5 days later and we haven't closed your event yet. You can come back in, and it's like, so this is still the same workflow if you decide I want to make some more changes. I don't know that what I did is exactly what I wanted. You're going to navigate back in just like we did before. It'll be a little different this time in that I'm not starting right at the beginning. It puts me right at the end because that's where I left. But it's going to get me to this page, and I believe, let's see if it grabs it. Yeah, it's going to, I think that's correct. It's kind of small screen for me, but yep. So you can, as long as I think as long as we haven't processed your event yet, just log back in and come back and click on that, and it should be able to generate a statement for you. Thanks for that question. And do we have any other questions coming in?
Yeah, they're coming in slowly. We'll go
Okay.
to our first one. So another anonymous attendee is asking, is there an at-a-glance table displaying plans affiliated hospitals so you won't have to go into each plan's microsite to look that up?
That's a great question. Let's go. I think the best resource for that is going to be on our website through your benefit guide, which you can link to from eBenefits, or if you're on our open enrollment pages and you scroll down, so depending which group you're in, for active employees, find your employer. So I'll just pick on city and county just because that's our largest population. And I'm going to scroll down so that I can get to the guide. There it is, all the way at the bottom. Good enough. Oh, that's requesting a guide. My apologies. Where is the guide? I overshot it. There it is. Okay. So let's go see what we've got for some comparison information. It may not necessarily have hospitals in it, but we'll take a look. There's certainly, sorry, I know I'm scrolling because I haven't been in this guide in a while. And I know Jessica is our communications director, so she's probably way more conversant with this than I am. But first you get a little comparison on the service areas, and hopefully you can see that. And then when we get here, this is a multiple page slide out that does nicely compare all your plans in one place. I don't know that it necessarily lists hospital affiliations, but it is at least showing you what you're paying for co-pays, maximum out of pocket, and various other hospital inpatient, maternity, outpatient sort of things. Yeah, that's what we've got for just a comparison, nice across the plans. I think we'll take that suggestion from you, though, as like a one-stop nice cheat sheet specifically with the hospital affiliations. Jessica, you may be able to just speak to that right now.
Generally speaking, so Kaiser, of course, is limited to only Kaiser facilities. The PPO can be used basically at every single facility, and that is nationally, because you can use in and out of network providers. For Blue Shield Trio and Access Plus, Trio has less providers and hospitals in their network than Access Plus. The biggest difference being some of the Sutter facilities and Palo Alto Medical Foundation. But the best way to look up the differences is really to go on the Blue Shield of California microsite for SFHSS, because we actually negotiated for our Trio plan, CPMC, and what was the other hospital? Maybe the Chinese hospital is also in there. And of course, you have access to Brown and Tolan with both Blue Shield HMO plans. With Canopy Care, some of the biggest difference is access to Zuckerberg Birthing Center, SF General. And I believe they don't have access to Brown and Tolan doctors or Sutter facilities. But they also have access to Chinese hospital.
Yeah, my other thought, thank you so very much for all of that great information, Jessica, because my other thought as well is that we've been hosting webinars all month long that really introduce to some of the differences and what you can get in your plans and how to maximize your plans. And so I know we're winding down in the month. There's still a few webinars left, but if there was one that was sort of either giving an overview of plans, or specifically we've had a couple introducing our new Canopy Care plan. If you've missed one, Jessica and her team have been posting the recordings of all of those webinars, so you can also go and learn about the different plans and your options, whether you're a retiree, Medicare, non-Medicare, and what you have available to you.
Exactly. And we have one more general overview next Tuesday, I believe, at lunch.
Yeah, so that is Tuesday, the 26th for active and early retiree employees. So this is for the non-Medicare population. You do have a general health plan overview, and that's another opportunity for you to get any additional questions specific to your plans covered.
Yeah, and I also want to answer, so Frances earlier, she asked, if I don't have changes on the health plan, do I still need to access eBenefits online and review? So it's our recommendation that you're always able to access eBenefits and you know how to navigate it. That's why we offer these classes. Because at any time throughout the year, you'll be able to check on your benefits. Let's say you're starting a family or you got married and you need to update your benefits, then you know exactly where to go to be able to make those changes. Plus, sometimes you just want to make sure, like, hey, this is the correct, elections that I want. Or if you need to make FSA changes during open enrollment, a lot of times people forget, like, oh, you have to enroll every single year. You know how to go online and be able to access your benefits. So we always recommend that you can access and you just do a double check. It never hurts, right? And it only takes a few minutes.
Especially because we find a lot of people, haven't seen their own data before. And so you might look and you see an address and you're like, well, I changed my address, so that's not the right one. But if we have the wrong home address for you, but we're mailing your OE packet to a mailing address, we might have the right mailing address, and you would never know we didn't have your correct home address. So there's a lot of great things to be had by you being able to see your own information. And also, certainly because of COVID, we've had to be more virtual, but we anticipate trying to do more through electronic delivery of your materials. It gets it to you faster and quicker. You can review it or take action at your own convenience. So, as you have time to get in and register, if you're a group that needs to register, just to get comfortable with the environment, we actually absolutely encourage it. And I see, yeah, please.
Go ahead, Rin.
No,
I
please
was
go.
just noticing the time and wanted to check in about questions and also note that I'm putting in some final links to find things as we end.
Great. Well, I'd like to thank everybody who attended and joined us today, and I hope this helps you feel more empowered to get in, and even if you just log on to look through your eBenefits. And we wish you an excellent rest of your open enrollment period. Again, October 29th, 5 p.m. Keep that one in mind, and thank you very much for joining and giving us your questions and your thoughts. And make sure I'm not ending us until Holly gets the final links that she wanted to add in there.
Yes, Rin, this is Holly. I've put the step-by-step instructions, the PDF on how to elect your benefits using eBenefits, and then I put that raffle link.
Great. Good luck, everybody, with the raffle.
Thank you, everyone.